The fluorescent lights hummed their mechanical song as Natalie Hayes pushed through the ICU doors at 6:16 a.m., her badge clipped precisely to the fourth buttonhole of her scrubs where it wouldn't snag on anything. 3 years. 1,095 days at Seattle General in Atlanta, and she had perfected the art of occupying space without being seen. Her shoes, regulation white nursing clogs, not the combat boots she kept in her locker, made no sound on the tile. That was intentional. Sound drew attention. Attention drew questions. Questions drew scrutiny she could not afford. The pre-dawn shift was hers alone, that sacred window before the day staff arrived with their coffee cups and their gossip and their tendency to leave when she sat down. She moved through the corridors with the fluid precision of someone who had navigated far more hostile terrain than a hospital, her eyes cataloging details without appearing to look, ventilator settings, for drip rates, the slight elevation of a patient's left side suggesting fluid accumulation. Her surgical scarred hands, hands that had held together more bodies than most surgeons ever would, moved across the keyboard with economical efficiency as she charted the overnight reports. The scars caught light sometimes, thin white lines crossing her knuckles like a map of decisions made in darkness, but the nurses who noticed never asked. That was understood. At 6:52 a.m., Dr. Marcus Whitfield entered the ICU without knocking, his lab coat pristine and pressed, his shoes polished to a shine that suggested someone else handled his laundry. He moved through the unit like a man who owned the walls, which, in every way that mattered, he did. His fingers trailed across the top of the medication cart as he passed, a casual gesture that would have seemed negligent to anyone not paying attention. Natalie was always paying attention. She watched as he bypassed 3 patient rooms and slowed at the 4th, Colonel Matthews, post-op from emergency abdominal surgery 23 hours prior, his broad shoulders still bearing the weight of whatever wars had shaped him. Dr. Whitfield glanced at her station without making eye contact. He had not made eye contact with her since the morning she flagged his billing discrepancies 3 years ago, the morning everything had started to fracture in ways neither of them acknowledged aloud. She turned back to her monitors, her jaw clenching so slightly that the muscle barely moved beneath her skin. Control. Always control. The tremor in her hands came only when she held a pen now, the smallest physical rebellion her body allowed itself, and she had learned to write her notes with the pen poised differently, distributed differently across her fingers, spreading the shake so thin it became invisible to anyone watching. But she never trembled when she held a scalpel. She never trembled when it mattered. That was the difference between a civilian and someone who had learned to compartmentalize fear the way other people compartmentalized their groceries. The field journal in her locker would tell the truth about those trembling hands if anyone ever opened it. Leather cover worn smooth from 1,000 nights sleeping in desert sand, from being clutched against her chest during mortar fire, from being clenched in white-knuckled fists when she realized that her careful documentation had become a weapon. The pressed poppy from Bagram, the one she had tucked into the journal during her final week there, it was still there, its dried petals fragile as memory, marking the page where she had written about a convoy ambush and a colonel with kind eyes who had carried his wounded team through 3 kilometers of enemy fire. The handwriting in that journal was hers, but it belonged to a woman who no longer officially existed. Lieutenant Commander Natalie Hayes had been erased from the Pentagon's databases when the operation went sideways, when the extraction team decided that some soldiers were too dangerous to come home, that their survival created complications that exceeded their value. She had accepted the disappearance like she accepted all orders, without argument, without visible emotion, with only the smallest acknowledgement in the form of a carefully controlled exhale. At 7:04 a.m., Natalie pulled up Colonel Matthews' post-operative file, her eyes moving across the medication orders with the speed of someone who had read thousands of similar charts. Everything was standard, fluids running at appropriate rates, antibiotics scheduled, vital signs stable. And then her eyes caught the morphine dosage in the orders. 12 milligrams every 4 hours. She leaned closer to the screen, her surgeon's instinct, the instinct she had trained herself to ignore in this place where she was supposed to be invisible, firing with sudden urgency. Post-op pain management required careful calculation based on weight, age, previous narcotic exposure, and renal function. Colonel Matthews was 215 pounds, 63 years old, no documented history of opiate dependency. The dosage was elevated. Not dangerously so, not in isolation, but elevated enough that it would justify higher billing under certain insurance codes. Elevated enough that the pattern she had noticed 3 years ago was still running, still operating, still turning patient care into a mathematics problem where the answer equaled profit. She documented the discrepancy in her notes with precision, the date, the time, the dosage, the clinical reasoning for why it concerned her, knowing that this documentation would be read and recorded and filed away in the archive of reasons why Dr. Whitfield had learned to despise her. 3 years ago, when she was still new enough to believe that the hospital wanted her observations, she had flagged something similar in his surgical supply orders. Vendor clusters that didn't match the hospital's standard purchasing protocols. Quantities that exceeded patient census by margins that seemed like simple overstock but, when examined across 6 months of data, began to suggest something far more intentional. She had brought her findings to the compliance department with a straightforward assumption that they would be grateful for the catch, the way any institution should be grateful for someone protecting its integrity. Instead, she had discovered that Dr. Whitfield's vendor relationships extended upward into the hospital's administrative structure in ways that made her documentation a threat rather than a service. The compliance officer had listened to her with an expression that gradually shifted from interested to uncomfortable to something colder. The recommendations she made were not implemented. The patterns she documented were reclassified as statistical variants. And Dr. Whitfield, who had somehow learned immediately what she had reported, probably from that same uncomfortable compliance officer, had begun the quiet work of making sure the hospital understood that Natalie Hayes was unreliable, overly ambitious, and prone to reading significance into data that was simply noise. The break room at 7:56 a.m. was a small study in isolation. Natalie opened her lunch container, grilled chicken, brown rice, precisely measured portions that required no thinking, and sat at the far end of the table. The room smelled like stale coffee and the fruity sweetness of someone's yogurt. Within 90 seconds, 2 nurses she had worked alongside for 3 years gathered their morning snacks and left without comment. She had stopped expecting them to stay. She had seen her name added to the public disciplinary board 6 weeks ago, a notation about insubordination and overstepping scope of practice, fabricated infractions constructed with such careful language that anyone reading them would conclude she was unreliable, difficult, unable to accept hierarchy. The documentation was perfect. It had to be perfect. Dr. Whitfield didn't do anything sloppily. That was what made him dangerous. She ate her chicken in silence, listening to the fluorescent lights buzz overhead with the constancy of insects. The sound had become familiar enough that she barely registered it anymore, the way you stop hearing your own heartbeat unless you're scared. She wasn't scared. That required surprise, and she had stopped being surprised by institutional corruption a long time ago. She had seen worse, so much worse. She had held a young Marine's hand while his legs were being amputated, had whispered encouragement as morphine moved through his fore, had promised him he would see his daughter again and meant it with the entire force of her will because sometimes that was all you could offer. This, the quiet erosion of her credibility, the slow work of making her into someone the hospital could dismiss, this was nothing. This was what happened when you threatened a system that had learned to bend itself around the people who understood how to manipulate it. At 8:12 a.m., as she was finishing her notes, a new patient arrived. The ambulance beeped twice as it backed toward the entrance, the distinctive sound that meant non-emergency transport, routine surgical recovery. But something in the ICU's energy shifted when the stretcher rolled through, a subtle change in the air pressure, the way a room feels different when someone important enters it. The patient was a Colonel, Green Beret, according to his file, post-op from emergency abdominal surgery performed by Dr. Whitfield himself. Routine. Except as Natalie watched the orderlies position him in the isolated recovery room, her eyes caught on something, a tattoo on the Colonel's left arm, faded by years but still visible. The ink had formed letters, the kind of memorial marking that soldiers got for people who mattered. The kind you saw in military culture all the time. Except she recognized these letters. She recognized them the way you recognize your own handwriting in a mirror. Natalie Hayes. The pen in her hand, still trembling in that barely perceptible way, completed the vital signs note as if nothing had changed. As if the room had not suddenly become a smaller place, as if time had not done something strange and impossible, folding in on itself like space bending around a gravitational anomaly. She finished the documentation with methodical precision, her hand steady now in a way that seemed almost cruel. Control. Compartmentalize. The Lieutenant Commander's first law: what you feel is not what you show, and what you show is not what you are. She saved the file, closed the screen, and in the moment before she stood to check on the other patients, she allowed herself exactly 2 seconds of absolute stillness. 2 seconds to process that the man who had saved her life was now in her hospital. 2 seconds to understand that Dr. Whitfield, who despised her and feared her and had built his entire institutional position on undermining her, was now about to discover something that might end everything. The morphine dosage seemed elevated for his weight and renal function. Natalie stood at Colonel Matthews' bedside during morning rounds, her voice steady and clinical. "Doctor, this dosage seems elevated for his weight and renal function." She kept her eyes on the monitor, not on Dr. Whitfield's face, though she could feel his irritation radiating like heat off summer asphalt. Dr. Whitfield turned slowly. His jaw tightened. The Colonel's adult daughter looked up from her chair, sensing the shift in the room's pressure. "I'm sorry, Nurse Hayes, did you attend medical school while I wasn't looking?" His voice dripped condescension, each word shaped like a blade. The hospital's fluorescent lights buzzed overhead, a sound like insects trapped in glass. "No, doctor, but," Natalie began, her tone respectful, careful, everything protocol demanded. "Then perhaps you should focus on taking vitals and leave prescribing to people with actual qualifications." He stepped closer to the bed, deliberately turning his back to her. "Vitals are my job. I perform them at 0600. Blood pressure elevated at 148/92. Heart rate 87. Oxygen saturation stable at 98 on room air." She delivered the information without defensiveness, without apology. Just data. Just fact. The Colonel stared at her with the intensity of someone searching for a memory that wouldn't surface. His eyes traced her face, the sharp cheekbones, the dark eyes, the scar along her left temple barely visible beneath her hairline. His own hand moved instinctively to his forearm, where beneath his hospital gown, beneath the pale skin of a man recovering from surgery, a faded tattoo read in careful military script, "N. Hayes." The recognition didn't come. "Not yet. Your lane, Little Miss Protocol, is wherever I tell you it is," Whitfield said, his voice dropping into the register he used when he wanted to humiliate someone thoroughly. "Now document what I ordered and move along." He didn't wait for her response. He never did. He simply dismissed her with the casual cruelty of a man who had never encountered consequences for anything he'd done. Natalie absorbed the shame with one measured breath. Her jaw clenched. She held the breathing for exactly 2 seconds, and in that silence, she felt the weight of 3 years, 3 years of this exact moment repeated in variations, 3 years of Whitfield's voice naming her as less than, as overstepping, as a nurse who should know her place. A single tear escaped before she could stop it. She wiped it away without breaking eye contact, without flinching, without giving him the satisfaction of seeing her break. Her voice, when it came, was quiet but edged with something harder than steel. "The patient's welfare is always my lane, doctor." The words hung in the room like a challenge no one had expected to hear. The Colonel's daughter stared at her. Whitfield's neck flushed red. For a moment, the only sound was the heart monitor's steady beep, a rhythm as measured and unflinching as Natalie's composure. Then Whitfield turned away, his authority reasserted through silence, through dismissal, through the power he wielded in this building. He wouldn't engage further. He didn't need to. He had already built his narrative, already positioned himself as the authority, already made it clear that her objections were the product of ambition that exceeded her qualifications. Natalie documented the medication concern in the patient's chart. The words were precise, clinical, bulletproof. RN noted post-operative morphine dosage of 15 mg every 4 hours appears elevated relative to patient's current renal function, creatinine 1.4, and body weight, 198 pounds. Dose equivalent to 0.076 mg per kilogram Q for H. Standard postoperative dosing for this weight typically 0.05 to 0.065 mg/kg. Clinical concern flag for physician review. Patient's daughter present. Patient stable. Oxygen saturation 98%, BP 148/92. She documented it not as a complaint but as an observation. Not as an accusation but as a clinical note that would create, in the hospital's permanent records system, an official timestamp of her concern. The next day, Natalie entered the break room with her lunch, a container of rice and grilled chicken that she'd packed at 5:27 a.m. before her son Jamie woke up. 3 nurses sat at the corner table, their trays scattered with half-eaten sandwiches and coffee cups that had gone tepid. They glanced at each other the moment she walked in. No words were exchanged. They didn't need to be. Within 7 seconds, one nurse gathered her tray, another her phone, the third her jacket. As they filed past Natalie, one whispered just loud enough to be heard, "Insubordination board." Isolation. Not dramatic. Not sudden. Just the quiet, systematic removal of human contact that happens when a workplace decides you're a problem. Natalie set her lunch on the table and ate it alone while the fluorescent lights hummed their endless, empty song. That afternoon, she walked past the unit's public disciplinary board posted outside the nursing station. Her name was freshly printed on the notice, professional and official, written warning for insubordination and overstepping scope of practice. Date: today. Authority: Dr. Whitfield, Department Head. Status: filed. The fabrication was clean, perfectly crafted, designed not to provoke but to document. With enough documentation, a pattern emerged. With enough pattern, a case could be made. With enough case, a dismissal could be justified. She read it twice, her hand steady, her face showing nothing. Then she continued her rounds as if the notice didn't exist, as if her name hadn't been painted in permanent marker across a board that everyone in the hospital would see. In the medication room, she encountered Janet Cho, a pharmacist she'd worked with for 2 years, 2 years of professional respect, of Janet always having her back during controlled substance counts, of conversation about Janet's daughter's college applications. Janet wouldn't make eye contact. "Sorry, Hayes, I have to verify everything you pull now." New policy. Natalie knew it wasn't policy. She'd worked here long enough to know what policy looked like. This was something else. This was the institutional machinery beginning to turn, Whitfield's pressure working its way through the system like poison through water. That evening, after she tucked Jamie into bed and made sure his homework was stacked on his desk for tomorrow morning, Natalie opened her bedroom closet. Behind her nursing uniforms, arranged in a shadow box with mounting hinges, sat a collection of medals. Bronze Star with Valor. Purple Heart. Navy Commendation Medal. The box was positioned so no one would see it unless they were looking specifically for it. Next to it, a field journal with a leather binding worn soft from handling. She opened to a page dated 14 years ago, in Bagram. The pressed desert flowers were still there, edges browning with time, fragile enough that she'd learned not to touch them except when absolutely necessary. Her own handwriting filled the page, carried Colonel M 3 miles through enemy fire after convoy ambush. His left leg was shredded, femoral artery compromised, bleeding out despite the tourniquet. He kept saying a name, his daughter's, I think. Sarah. He kept saying Sarah. Told him to save his breath. He squeezed my hand and said, "I'll remember. I'll remember you." But how could he? He was barely conscious. Blood loss at that level, brain hypoxic. He wouldn't remember anything except that someone got him out. And I need him to forget. I need all of them to forget. She closed the journal and placed it back behind the shadow box. Jamie had no idea what was hidden there. Jamie thought his mother was a good nurse at a hospital that was becoming difficult. Jamie didn't know about Bagram, about the unit, about the reason she'd been inserted into Seattle General in the first place. What she didn't know was that the machinery was already moving faster than she'd anticipated. In Dr. Whitfield's office, Investigator Morris sat on the other end of a phone call, his voice carrying the satisfied tone of a man who'd found exactly what he was looking for. "You were right, Doctor. Natalie Hayes has almost no verifiable employment history before Seattle General. Her military references come back as non-existent. Records show she never served anywhere, no service, no discharge papers, nothing. It's like she appeared in Atlanta 3 years ago from nowhere." Whitfield leaned back in his chair, a smile spreading across his face like a predator recognizing that the prey was finally cornered. He had no idea that the woman who'd made his life difficult, the one who saw through his billing schemes and his inflated dosages and his systematic manipulation of the hospital's trust, was about to become something far more dangerous than a whistleblower. He had no idea that the man in bed 412, the one who'd seemed to stare at her with such inexplicable intensity, was about to recover fully from surgery and begin asking nurses questions about where she came from. He had no idea that in 72 hours, everything he'd built would begin to crumble. But that wasn't the worst part. The worst part was that Whitfield's investigation had triggered a protocol. A phone call had been made to a number that no longer officially existed. And somewhere in Arlington, Virginia, a file marked classified was being pulled from an archive. At 0200 hours, Colonel Matthews woke screaming. Not the distant whimper of a man in mild pain. This was raw, primal, a sound that came from the deepest part of the brain, the part that knew something was profoundly wrong. His right leg had swollen in the 4 hours since surgery, the calf now stretched tight as a drumhead, the skin shiny and mottled purple. His daughter, Sarah, jerked upright in the visitor's chair where she'd fallen asleep, her hand reaching for his shoulder. "Dad? Dad, what's wrong? Can't feel my foot. It burns. Everything burns." His voice was fractured, barely coherent through the pain. "Get someone. Get a doctor." Sarah hit the call button and kept pressing it. Natalie was finishing a medication round 2 floors up when the overhead chime signaled an urgent call from the colonel's wing. She heard her name first, the charge nurse's voice clipped and tight. "Natalie, need you in 4218 stat. Patient in distress." She didn't run. Running creates panic in other staff. Instead, she moved with the economical precision of someone who'd crossed hostile territory with a wounded man on her back, each step deliberate, each movement a resource conservation. The 4218 hallway corridor smelled of antiseptic and the faint metallic edge of anxiety that sent human bodies release when adrenaline spikes. She could smell it on Sarah before she even entered the room. The moment Natalie saw Colonel Matthews' leg, her entire nervous system locked into mission mode. The calf was swollen to nearly twice its normal diameter. The skin had that characteristic tight, shiny appearance, skin stretched to its maximum, the kind of tautness that meant pressure was building inside the compartment faster than the tissue could expand. His foot was dusky, the color wrong. Pain disproportionate to injury was what Natalie's field medicine instructor had hammered into her skull during her 3rd deployment, in a field hospital in Bagram, surrounded by dust and diesel exhaust, with mortar rounds echoing in the distance. He'd shown her photographs of compartment syndrome. "You won't see this in trauma," he'd said. "You'll see it in post-ops. A swollen leg that doesn't match the injury. That's tissue necrotizing in real time. You catch it, you save the limb. You miss it, you're amputating by week 2. This was compartment syndrome. The clinical signs were screaming at her, pain out of proportion, swelling, tight compartment, distal pulses diminishing. Without emergency fasciotomy within the hour, the muscle tissue inside that leg would begin dying from lack of blood flow. How long has he been in pain like this? Natalie's voice was level, steady. Maybe 5 minutes before he started yelling, Sarah said, her face pale. The nurses before you, they just checked his vitals and said everything looked normal. Normal. Natalie glanced at the monitor. Vitals were indeed stable. Heart rate elevated from pain, but not dangerously so. Blood pressure climbing slightly. A patient with normal vitals and excruciating pain, that was the trap. You looked at the monitor and thought the patient was fine. You looked at the clinical picture and understood someone was hours away from permanent disability. I need to call Dr. Whitfield. Natalie moved to the bedside phone with the economy of motion of someone who'd been trained to move through a hospital the same way she'd moved through Kandahar province, necessary, visible, unremarkable. She dialed the surgeon's number from memory. It rang once. Twice. The voicemail picked up. You've reached Dr. Whitfield's answering service. For emergencies, please page. She hung up and dialed the operator. I need to page Dr. Whitfield for Seattle General. Post-operative emergency, patient Matthews, room 4218. This is urgent. 3 minutes passed. The pager response came back, page acknowledged. Natalie waited. She'd learned patience in military service, the kind of patience that comes from understanding that sometimes the best tactical move was to let the other person make their mistake first. But patience had limits. At the 5-minute mark, with Colonel Matthews' pain climbing toward incoherence and his daughter's hand trembling as she held his, Natalie picked up the phone again and dialed the on-call surgical attendant. This is Dr. Chen, the voice answered on the third ring, still groggy. Who's calling? This is Natalie Hayes, RN, Seattle General. I have a post-operative patient with acute compartment syndrome developing in the right lower extremity. Swelling, pain out of proportion, distal pulses diminishing. Needs emergency fasciotomy. Whitfield is his attending but isn't responding to pages. The silence on the line lasted exactly 2 seconds. Then, that's Whitfield's patient. He doesn't like other attendings touching his cases. Page him again. Wait for him to respond. I have paged him twice. Patient is deteriorating. Natalie, I understand, but Whitfield will call my head of medicine if I step in. Page him a third time. Give him 10 minutes. If he doesn't respond, call me back and we'll figure out who's on call for emergencies. The line went dead. Natalie stood motionless for perhaps 3 seconds. In that 3 seconds, her mind ran through a cascade of data, compartment syndrome progression timeline, tissue viability windows, the difference between nerve damage at 1 hour versus nerve damage at 3 hours. Pain was information. Pain was the tissue talking. And this tissue was screaming that it was dying. She paged Dr. Whitfield a third time and marked the time in her mind, 0213 hours. Then she went to Colonel Matthews and performed a compartment assessment. She pressed her fingertips into the lateral compartment of his calf and felt the pressure beneath the skin, that tense, unyielding resistance that meant the pressure inside was climbing. She checked his dorsalis pedis pulse again. Thready. Weakening. His foot was cooling. His toes were beginning to lose color. Sir, your surgeon needs to perform an emergency procedure to relieve the pressure in your leg. It's called a fasciotomy. We need to get you to the operating room in the next 60 minutes or your leg is at risk. Colonel Matthews' eyes cleared slightly through the morphine haze, focused on her face. For just a moment, so brief she almost missed it, something flickered in his expression. Recognition. A shadow of something he couldn't quite name. But pain pulled him back under before he could speak. Sarah stood up. Where is his doctor? Why isn't he here? I'm working on that. Natalie's phone buzzed in her pocket. A text. She read it standing perfectly still while her mind processed what she was seeing. Manage conservatively. I'll see him on morning rounds. Whitfield. The text timestamp 0215 hours. Conservative management was code for wait and see, elevate the leg, give pain medication, hope the swelling goes down on its own. Conservative management was how you lost a limb. Conservative management was how you let muscle tissue die while you slept. Natalie looked at her watch. 0216 hours. She looked at Colonel Matthews, whose entire right leg was now the color of an eggplant and whose foot was ice cold. She looked at Sarah, whose 17-year-old face was crumbling toward panic. And she made a decision that would end Dr. Whitfield's career. Sarah, I need you to step outside for a moment. Your father's going to be okay, but I need to make some calls." She waited until Sarah left the room. Then she picked up the hospital phone and called the charge nurse directly. "This is Natalie. I need a fasciotomy kit brought to room 4218 immediately and notification to the OR that we're prepping for emergency surgery." The charge nurse's voice came back hesitant, careful. "Dr. Whitfield hasn't authorized." "Then he can fire me in the morning," Natalie said, and her voice had shifted. It was no longer deferential. It was no longer asking. It was the voice of someone who'd spent 7 months embedded in Kandahar coordinating medical evacuations under active fire, someone who understood that hesitation in a medical crisis wasn't caution, it was complicity in harm. "Get me the fasciotomy kit. Call the OR. Now." "Natalie, I don't think." "Compartment syndrome. Active tissue necrosis. Patient will lose limb or lose life in 60 minutes without intervention. That's not think territory. That's act territory. Get the kit." She hung up before the charge nurse could argue further. Her hands were steady. They were always steady when the mission began. The trembling was something civilians did. The trembling was what happened when you weren't trained. Lieutenant Commander Natalie Hayes had held a tourniquet on a green beret's femoral artery while helicopters circled overhead and the sun melted the sand into glass. She had performed emergency airway management in a field hospital where the only anesthesia was battlefield morphine and grit. Her hands didn't tremble. Her hands did the work. She returned to Colonel Matthews' bedside and began the preoperative assessment with the kind of methodical precision that came from having run this exact sequence in the worst possible conditions. Vitals. Allergies. Last meal time. She documented everything with the same meticulous attention to detail that had originally caught Dr. Whitfield's billing fraud 3 years ago, the same attention that had painted a target on her back. The charge nurse appeared at the door with the fasciotomy kit. There was conflict written across her face, the battle between institutional hierarchy and the undeniable reality of a dying limb. But she set the kit down on the bedside table without another word. "I'm calling the OR again," the charge nurse said quietly. "I'll tell them you're coming up with or without authorization." "And Natalie," she paused. "Whatever you're doing, whatever this is, I didn't see it." The charge nurse left. At 0223 hours, they rolled Colonel Matthews toward the elevators. His daughter walked beside him, her hand gripping his, asking questions that Natalie didn't answer because answers would require hope she couldn't guarantee. The elevator doors opened. The smell of the hospital shifted, the ventilation system changing as they moved through different zones, the air becoming colder, more clinical, the scent of surgical disinfectant replacing the medicinal sweetness of the patient ward. Natalie stood at the elevator's edge, her hand resting on the stretcher rail, her eyes fixed on the colonel's swollen leg as the doors began to close. In that moment before the doors shut, Colonel Matthews turned his head toward her. His eyes were still hazed with pain, but something had shifted in them. Some recognition that didn't quite surface, but was there nonetheless, the way a drowning man recognizes the shape of a boat even through the water. Then the doors sealed closed. And somewhere in Dr. Whitfield's home, in a bed he wouldn't leave for another 2 hours, his phone sat silent on his nightstand. The message he'd sent at 0215, managed conservatively, was already becoming a problem he didn't know existed. The night shift continued. The fluorescent lights buzzed overhead. Rain began to hammer against the hospital windows, the sound like applause for a performance no one was supposed to witness. The scalpel was already in her hand. Natalie didn't remember reaching for it, but muscle memory doesn't wait for conscious thought. Her fingers knew this weight, this balance, the exact pressure needed. The charge nurse, Martinez, stood across the surgical field with eyes wide, hands trembling as she prepped the sterile field around the colonel's swollen calf. Rain continued hammering the windows outside the procedure room, but inside, there was only silence and the soft beep of the monitor tracking a life that depended on the next 90 seconds. "Okay, Colonel," Natalie said quietly, her voice dropping into the register she hadn't used in 3 years, the one that came from rooms where explosions rattled the walls and morphine was a luxury they couldn't afford. "I've got you." Stay with me. The first incision was clean. Practiced. Her hand moved like a surgical laser, precise and unflinching, the blade finding the fascial plane between muscle groups with the certainty of someone who had done this exact procedure in a field hospital outside Bagram while rounds impacted the concrete wall 3 feet away. Blood welled up, and Martinez gasped, but Natalie was already moving, already releasing the pressure that was strangling the tissue, already saving the leg that Whitfield's negligence would have cost. 15-gauge needle, Martinez. Now. Yes. That changed something in the room's air pressure. Martinez heard it too, the shift from nurse to something else. Something with authority that couldn't be questioned. The fascia released with a soft hiss as Natalie made the second incision, relieving the compartment pressure that had been building toward irreversible damage. The colonel's pain immediately decreased. She heard it in his breathing, saw it in the slight relaxation of his jaw. His color was already improving, oxygen saturation climbing on the monitor, 89%, 91%, 94%. Normal. Stable. You're doing good, sir, Natalie whispered, and there was nothing civilian in those words. They were the words of someone who had whispered the same thing to a bleeding man while dragging him through 3 miles of desert with rounds churning up the dust around them both. 23 minutes. That's how long the procedure took. 23 minutes and the colonel's leg was saved. The fasciotomy was complete, the sutures closing with the kind of meticulous precision that came from having your hands trained by trauma and consequence. When Natalie stepped back, peeling off her gloves, she was breathing normally. Her hands were steady. There was no tremor, no relief visible on her face, just the blank professionalism of someone who had done harder things in worse places. The doors to the procedure room burst open at 02 for 7 hours. Dr. Whitfield stood in the threshold still wearing his street clothes, an Italian wool coat soaked with rain, designer loafers tracking water across the sterile tile. His face was the color of old concrete. He looked at Natalie standing over the colonel's exposed leg, blood still visible on her gloves, and something in his expression fractured like tempered glass. "What the hell do you think you're doing?" His voice was a whip. Natalie didn't look up. She was finishing the final suture with the kind of care that suggested she had all the time in the world, even though she didn't. The tape securing the surgical site was being applied with the precision of someone who understood that sloppy work killed people. "Saving your patient's leg, doctor." Compartment syndrome. Another 20 minutes and he'd have lost it. She said it the way someone might comment on the weather, flat, factual, devoid of accusation even though every word was an indictment. "You just performed surgery without authorization." Whitfield's voice was climbing now, pitched toward something between rage and panic. "That's not nursing. That's practicing medicine without a license." Natalie stood. Removed her gloves. Met his eyes for the first time. Her gaze was the kind of calm that comes from having already survived the worst the world has to offer, the kind of composure that only terrified people who understood what it meant. "No, doctor." Her voice had dropped an octave. It sounded like it belonged to someone else entirely, someone with authority that didn't need to be announced because it was written in every line of her body. "That's a battlefield procedure any combat medic can perform. Which you'd know if you'd ever served." The words hung in the air like shrapnel suspended in slow motion. Whitfield's face went through a series of transformations, red to purple to white, and when he finally spoke again, his voice had dropped to something colder than rage. "Ice doesn't need to shout. Ice just freezes everything it touches. Get out. You're done here. Security will escort you from the building." Natalie peeled off her surgical mask. She looked at the colonel, whose eyes were locked on her face with something like recognition beginning to surface. She looked at Martinez, whose hands had stopped trembling but whose face was pale with the understanding that she had just witnessed the end of something. Then she walked past Dr. Whitfield without another word. By 0900 hours, Whitfield had activated his full network. The phone calls had started in the pre-dawn darkness, the kind of calls that only powerful men make when they understand they're losing control. Board member Gerald Hutchins, who owed Whitfield 3 years of favors and a 6-figure consulting contract, convened an emergency personnel review. The external investigator, a man named Crawford who had been chosen specifically because he was thorough and incurious, delivered his report to Human Resources by 0845. Subject's military service cannot be verified. No records with Department of Defense. No discharge papers. No service jacket. Background prior to employment at Seattle General shows significant gaps. Security clearance verification impossible. Recommend immediate termination pending fraud investigation for credential misrepresentation. The report was 3 pages. It was also completely accurate. That was the genius of it. Natalie Hayes did not exist in any official capacity. No birth certificate that could be traced. No military records that wouldn't dissolve like sugar in water if anyone tried to verify them too closely. She had been ordered to disappear after an operation in Bagram went sideways, told that the only way to stay alive, the only way to keep her family safe, was to vanish completely. Officially, Lieutenant Commander Natalie Hayes had never existed at all. Security appeared at her side at 1,600 hours, as she was finishing her charting on Colonel Matthews' post-operative notes. "Ms. Hayes, you need to come with us." The guard's name was Peterson. He'd always been kind to her. His discomfort was written across his face like a confession. She stood without argument. Followed him to her locker. The walk through the unit was a corridor lined with silent witnesses, nurses and techs and orderlies all pretending to work while watching her pass. One of the charge nurses met her eyes with sympathy. Most looked away. The fluorescent lights buzzed overhead like insects trapped in amber. Her locker contained almost nothing. 3 years of work and there was almost nothing to show for it. Her stethoscope, a gift from her father before he died, a Littman cardiology for with her initials scratched into the chest piece. Her pens. A half-empty bottle of lotion. And beneath the shelf, wrapped in a plastic bag she'd hidden there months ago when the pressure started building, the field journal with pressed desert flowers still caught between its pages, flowers from a garden she'd seen once, on leave, in a place that didn't exist anymore. Peterson handed her a cardboard box. Standard issue. The kind used for terminations. She packed slowly, each item a small punctuation mark on 3 years of invisibility. When she closed the locker for the last time, the sound echoed like a vault ceiling. The walk out of the hospital took forever and no time at all. Her badge was deactivated before she reached the parking lot. The rain had stopped. The sky was the color of old bruises, purple and yellow and utterly without hope. She sat in her car for 17 minutes without starting the engine, her hands on the steering wheel, before driving home. Jamie was still at school when she arrived. She had 2 hours before he came home and found his mother sitting at the kitchen table with her head in her hands, no longer crying because she'd used up that ration, just sitting in the particular silence of someone watching everything they'd built become invisible again. When the door opened at 1,530 hours, Jamie stopped in the doorway. He was still in his school uniform, still carrying his backpack, still a child who hadn't yet learned that the world sometimes decides you don't get to be what you are anymore. "Mom, why are you home early?" His voice was small. Confused. Afraid. The words wouldn't come. Natalie opened her mouth and closed it again. She'd faced down insurgents and interrogators, had kept men alive with her hands and her will and her refusal to break under pressure, but she couldn't find the words to tell her son that the only place she'd ever truly belonged had decided she'd never existed at all. The door to the administrative conference room opened at 8:06 a.m., and nobody moved. Jamie Hayes stood in the threshold wearing his school uniform, 14 years old, holding a shadow box like it was made of glass. The medals inside caught the fluorescent light, bronze and ribbon and hard-won metal that didn't belong in a hospital during a disciplinary hearing, but here they were. His voice carried the weight of someone much older. "My mom is Lieutenant Commander Natalie Hayes." The room exhaled. Karen Wells, the hospital's chief administrator, set down her pen. Board member Hutchins blinked twice. Dr. Whitfield's attorney stopped mid-sentence. And Natalie, sitting in a chair across from the 3 people who decided her fate, turned to look at her son with an expression that cycled through terror and fury and a kind of aching pride she'd spent 14 years trying to hide. "Jamie, you can't be in here," she said quietly. "Yes, I can," he replied. "Because you're a hero, and I'm your witness." He stepped into the room fully and set the shadow box on the conference table. The medals lay mounted on navy felt, Bronze Star with Valor, Purple Heart, Navy Commendation Medal. Each one a scar turned into metal. Then he pulled out the journal. Natalie recognized it immediately. The green canvas cover was water-stained and fragile. The pressed desert flowers, 5 of them, papery and brown, were still tucked between the pages exactly where she'd left them 8 years ago. She'd kept that journal in a showbox in her closet, underneath winter scarves she never wore, wrapped in a plastic bag sealed with duct tape. She'd never shown it to anyone. Not her former husband. Not her commanding officers. Not even the psychiatrist who'd helped her transition from military to civilian life. Jamie opened it to a marked page and handed it to his mother. Natalie's hands were steady, they had to be, but her voice dropped an octave as she began to read aloud. Day 47, Bagram Airfield. Convoy was supposed to return at 1900 hours. We were hit at 1842, incoming fire from the ridgeline south of the compound. The Humvee ahead of us took shrapnel. Colonel Matthews was the only one moving when I reached him. Compound fracture of the left humerus. Abdominal wound. Bleeding out. Distance to FOB Shank, 4.7 kilometers. No air support available. No medevac inbound. Just me and a man who wouldn't stop talking about his daughter's name day, trying to keep him conscious while we moved through the pass. I counted every step. Every breath. Every time he said Emily's like it was a prayer. Made it to the gate at 2,104 hours. He lived because I didn't stop. I will never see him again. I was ordered to disappear. She closed the journal. Her eyes were dry. The room was silent enough to hear the air conditioning system laboring through the vents. Colonel Matthews stood up. Recognition didn't flood his face slowly, it crashed through him like a defibrillator pulse, like muscle memory suddenly screaming that the nurse he couldn't place, the woman whose name he'd tattooed on his arm and carried for 8 years without knowing her face, had just read her own words aloud. He rolled up his sleeve. The tattoo was right there, N. Hayes, ink dark and permanent, etched over the scar tissue of the wound she'd described. Bronze Star with Valor, he said, his voice steady but thick. Purple Heart. Navy Commendation Medal. She's the one who saved my life. He wasn't looking at the medals. He was looking at Natalie. I got your name tattooed so I'd never forget. Even when the blood loss made everything else disappear. Even when the doctors said I was hallucinating. Even when the classified debriefing told me you'd been disappeared from the record. I kept your name right here. He pressed his palm against the tattoo. And I walked past you every single day. The door opened again. 2 agents from the Federal Bureau of Investigation stepped into the room with the kind of bearing that made every attorney in Atlanta suddenly wish they'd charged more money. Agent Torres held a folder so thick it could have held the hospital's entire billing system. Because it did. Lieutenant Commander Natalie Hayes was embedded at Seattle General on orders from the Pentagon, Torres said without preamble. Her mission was to document Dr. Whitfield's billing fraud operation, the inflated surgical orders, the kickback scheme with medical supply vendors, the falsified documentation. She gathered evidence for 18 months while maintaining her cover as a registered nurse. That cover is now officially lifted. Whitfield's attorney was on his phone. I don't care what the retainer was. He didn't tell me about any federal investigation. I'm withdrawing representation effective immediately. He hung up and left the room before anyone could respond. Security appeared at the door with handcuffs. Dr. Gerald Whitfield, you're under federal arrest for fraud, conspiracy to defraud the United States, and falsification of medical records, Torres said. The cuffs clicked with the sound of endings. You have the right to remain silent. But before they could move him, the external investigator Morris appeared in the doorway. Torres acknowledged him with a nod. "Mr. Morris, thank you for your cooperation with our investigation. Your testimony about being hired to fabricate the credential report on Lieutenant Commander Hayes will be noted in your plea agreement." Morris wouldn't meet Whitfield's eyes. Wouldn't look at Natalie. Just nodded and left the same way he'd come. Whitfield's voice cracked. "You flipped my own investigator." Nobody answered. The marshals guided him toward the door. Karen Wells addressed the room with the precision of someone dismantling a building from the inside out. "This hearing is concluded. Dr. Whitfield's hospital privileges are permanently revoked, effective immediately. Lieutenant Commander Hayes, you are reinstated with full back pay and a formal apology from this institution." She stood and extended her hand to Natalie. "Welcome home, Lieutenant Commander. We're honored to have you serve Seattle General properly." Natalie shook her hand once, firmly, then turned to her son and pulled him close. Jamie was trembling, a genuine shock now that the worst was over. She kissed his forehead and held him long enough for him to stop shaking. Colonel Matthews approached slowly, like he was approaching a wounded animal he didn't want to spook. "I should have recognized you," he said. "Emily talks about that night. I told her about the nurse who saved me, who I couldn't remember clearly because of the blood loss and the morphine. I got your name tattooed so I'd never forget, and then I looked right at you and didn't know." Natalie's voice was quiet. "You weren't supposed to recognize me, Colonel. That was the point." "Well," he said, and something in his expression shifted. The point changed. Security escorts moved through the corridors with Dr. Whitfield between them, and the hospital's staff lined the hallway like witnesses to her execution. Nurses watched in silence. The medication room nurse, the one who'd avoided Natalie's gaze for 3 years, met her eyes from down the hall and mouthed, "I'm sorry." The charge nurse who'd assisted with the fasciotomy stepped forward into the empty space left by Whitfield's absence. "Lieutenant Commander, we'd be honored if you'd continue working with us." Natalie looked at the faces surrounding her, faces that had turned away, faces that had whispered, faces that were now seeing her fully for the first time. She nodded once. "I'm ready to go back to work." 6 months later, Colonel Matthews conducted his routine night security rounds at Seattle General. He'd taken a part-time consulting role training the hospital's disaster response team, teaching the next generation how to triage under fire, how to make decisions when every option feels impossible. As he passed the main entrance security desk, a familiar figure checked visitor badges under the fluorescent hum of his former empire. Dr. Whitfield, wearing a blue security uniform, didn't look up as the colonel approached. His medical license revoked. His assets frozen pending restitution. This was what remained, a man checking names off a list, invisible, powerless, a daily reminder that the quiet ones had always been the dangerous ones. The colonel paused. "Working hard, Doctor." Whitfield's jaw tightened, but he said nothing. Later that night, in the ICU, Natalie finished rounds with a new cohort of nursing students. She'd been appointed to the ethics committee and training oversight. One student asked, "Lieutenant Commander Hayes, what do we do when we see something wrong but speaking up might cost us everything?" Natalie opened the field journal, now part of her teaching materials, and showed them the pressed desert flowers. "You do what's right anyway. Because power is not a title. Power is the ability to help." The student scribbled notes. In her office, she had an office now, Jamie video called from school. "Mom, my career day presentation on you got an A." She smiled, "I'm proud of you, sweetheart." In the background, she saw the shadow box of medals displayed on his desk. She used to hide them. Now he carried them. As night deepened, Natalie walked past the disciplinary board where her name once appeared in shame. Now it was mounted on a different wall, Lieutenant Commander Natalie Hayes, MSN, RN, Distinguished Service Award for Excellence in Patient Advocacy. She didn't pause to admire it. She had patience to see. On her way out, she passed Colonel Matthews in the corridor. He nodded with respect. And at the security desk below, Dr. Whitfield watched them both, finally understanding what he never saw. The quiet ones are often the most dangerous, and the nurse he tried to destroy was always the one with the power. If this story resonated with you, if you've ever seen someone underestimated or wronged for doing the right thing, please like and subscribe. Comment below. Have you ever witnessed institutional corruption and had to choose between silence and sacrifice? What would you have done in Natalie's position? We read every comment. Thank you for watching.